Welcome to the Skip channel and subscribe the channel. Today we will see the anatomy of the scapula bone. This bone otherwise called as a shoulder blade, right? First we will see the side determination of this bone. There is the large lateral angle. This bears the large clinoid cavity, right? This is the first one, side determination. Then second one is the lateral border is very thick. It is run from the clinoid cavity to the inferior angle, right? Then another one is the coastal surface is the concave, right? Coastal surface is the concave. Then dorsal surface convex, right? It is divided by the spine process as a two part, above the supraspinous fossa, below the infraspinous fossa. These are the side determination of the scapular bone. Then we will see the what are the features of the scapular bone. There are two surface. This is a dorsal surface in front, costal surface, right? There is the three border, right? This one is the medial border, this one is the lateral border, this one is the superior border. Then we will see the what three angles. This one is the superior angle, right? This one is the inferior angle. This one is the lateral angle or clinoid cavity, right? Then scapula has the three process: spine process, right? Then acromion process, then coracoid process, right? These are the features of the scapular bone. Then we will see the other features. There are infraglenoid tubercle, right? Then suprascapular notch. This one is the infraglenoid tubercle. This one is the neck of the scapula. This one is the supraglenoid tubercle. These are the other features of the scapular bone, right? Now, now we will see the what are the attachment in the costal surface of the scapula, right? There is the there is the large subscapularis muscles origin, right, in the subscapular fossa. Then the serratus anterior muscles insertion is the medial border of the scapular bone, right? Then we will see that in the infraglenoid tubercle, there is the long head of the triceps muscles origin, right? In the supraglenoid tubercle, the long head of the biceps muscles origin. In the tip of the coracoid process, there is the coracoid brachialis and short head of the biceps brachii muscles origin. Then in the acromion process, there is the deltoid muscles origin. There is the coracoid process, pectoralis minor insertion. Then there is a two ligament in the coracoid process, coracoclavicular ligament that is the attached the clavicular bone and the coracoid process. This is the suprascapular ligament in the suprascapular notch. Then we will see the attachment of the dorsal aspect of the scapular bone. There is the there is a supraspinatus muscles origin in the supraspinous fossa. Then the trapezius muscles insertion in the upper lip of the spine process. Then the deltoid muscles origin in the lower lip of the acromion process, right? Then the intrascapular fossa, there is the infraspinatus muscles origin, right? Then the in the lateral border of the scapula bone there is the teres major muscles and two lip of the teres minor muscles origin, right? Then in the inferior angle there is the latissimus dorsi muscles origin, right? Latissimus dorsi muscles. There is the lower uh, lower border of the medial border of the scapula bone there is a rhomboid major muscles incision. Then upper part of the medial border of the scapula bone there is the rhomboid minor. Above the rhomboid minor there is the levator scapula muscles incision. Then this is the capsule of the shoulder joint, right? Then we will see the clinical importance of the scapula bone. The first one is the winging scapula. This is occur. There is the paralysis of the serratus anterior that causes the winging scapula. That means the medial border of the bone become unduly prominent, right? And the arm cannot abduct beyond the 90 degree. So above the 90 degree, the serratus anterior muscle support to the abduction of the arm, right? If the serratus muscles paralyzed, we can abduction. Here you can see the winging scapula, right? Then another one is the scaphoid scapula. This is the scapula medial border is become as a concave. That is why this scapula called as a scaphoid scapula. These are the clinical importance of the scapula bone, right? And thanks for the watching our channel.